There's different reasons why some women experience menstrual cramps more than others. Sometimes it's just a normal physiological process that we all tend to have, but some women tend to secrete more of the physiological prostaglandins that we secrete during that time that causes pain. There are secondary causes as well that can cause cramps and more pathological, such as fibroids, endometriosis, or adenomyosis. Usually there are some dietary changes that could be done. Increasing vitamins is very helpful. Changing to a low vegetarian diet can help as well. Also, they can take medications over the counter that can help prevent them if they're taken a few days beforehand to prevent the cramps that develop during their menstrual cycles. There are certain exercises that can be done, such as yoga. There has been some studies that acupuncture can help during that time. Also, avoiding caffeine during that time during the menstrual cycle can help prevent menstrual cramps. The woman should seek medical advice for their painful menstruations at any point in time. I believe that they don't have to wait to experience this pain multiple times. If they are very concerned about their pain, then the woman should come and see the physician and seek medical advice at any point in time.
Okay, now.
Yes, you should be concerned if there's any incontinence, leaking during laughing or coughing, or having any urgency symptoms as well. Sometimes incontinence is not necessarily just due to age. It could be because of some other, more worrisome processes such as malignancy or neurological disorders. So I believe that at any point in time that the patient is concerned or notices any kind of incontinence, especially during coughing or laughing, they should seek a physician. The causes of incontinence are many. It could range, and it depends on what type of incontinence that the woman is having. There is stress incontinence, again, because of coughing or laughing, and then there's also urgency incontinence secondary to problems with the bladder. So there are many causes. It just depends on what type of incontinence they're having. It could be, for instance, for stress incontinence, it's mainly secondary to childbirth, whereas overactive incontinence is mainly secondary to age. Yes, menopause can affect incontinence. Sometimes it makes it worse. There are estrogen receptors that are located in the lower urinary tract, and so when we become menopausal, that loss of estrogen can cause many different changes in that tract and cause incontinence. There are different ways to prevent incontinence, such as weight loss if we tend to be obese. Controlling different diseases such as diabetes or neurological disorders can help prevent it. There are also certain pelvic floor exercises that can be done, and also behavioral techniques that can prevent incontinence. Also changing our diet, decreasing our alcohol intake, decreasing caffeine, and also decreasing the amount of fluid intake right before we go to bed can help prevent incontinence. Surgical management for incontinence comes into play more when any of the conservative measures are not working for the patient. So if she feels that she is following every conservative tip that her physician has given her, but she is leaking despite this, then surgical management may be more appropriate for that woman. There are different types of surgical procedures that are out there for incontinence. It just depends on what the patient's symptoms are. They do have to go further, undergo further testing, such as a urodynamic study, to better explain or give us more information on what kind of incontinence they're having. Are they having the overactive incontinence? Is it purely stress, or is it mixed? So it just depends on what those findings show that curtails what kind of surgical management is best for the patient. It could be, most procedures are minimally invasive. They don't require extensive surgery or anything, and it can be done in one day, and the patient goes home on that day.